Welcome you all in Liza's classroom. Today's topic is cancer, breast cancer and health. This video has been prepared to help you understand about the cancer and especially the breast cancer. So, take a look. What is cancer? Cancer is a disease of the cells which are the body's basic building blocks. The body constantly makes new cells to help us grow, replace worn out tissue and heal injuries. Normally, cells multiply and die in an orderly way. It is caused by mutation or by some other abnormal activation of cellular genes that control cell growth and cell mitosis. Cancer is a disease in which a group of uncontrollably by disregarding the normal rules of cell division which produce tumors. Tumors are generally two types, benign tumors and malignant tumors. Benign tumors. Cells are confined to one area and are not able to spread to other parts of the body. This is not cancer. And the malignant tumor is made up of cancerous cells which have the ability to spread by traveling through the bloodstream or lymphatic system. Sometimes cells don't grow, divide and die in the usual way. This may cause blood or lymph fluid in the body to become abnormal or form a lump called a tumor. A tumor can be benign or malignant. The cancer that first develops in a tissue or organ is called the primary cancer. A malignant tumor is usually named after the organ or type of cell affected. A malignant tumor that has not spread to other parts of the body is called localized cancer. A tumor may invade deeper into surrounding tissue and can grow its own blood vessel. If cancerous cells grow and form another tumor at a new site, it is called a secondary cancer or metastasis. A metastasis keeps the name of the original cancer. For example, breast cancer that has spread to the bones is called metastatic breast cancer, even though the person may be experiencing symptoms caused by problems in the bones. There are several types of cancer, such as breast cancer, bone cancer, brain cancer, etc. Here we discuss about the breast cancer. In women, breasts are made up of milk glands. A milk glands consist of lobules and ducts. Lobules, where milk is made, and the ducts, the tubes that carry milk to the nipples. Both female and male breast contain supportive fibers and fatty tissue. Some breast tissue extend into the armpit. This is known as the axillary tail. What is breast cancer? Breast cancer occurs when the cells lining the breast lobules or ducts grow abnormally and out of control. A tumor can form in the lobules or ducts of the breast. Women and men can both get breast cancer, although it is rare in men. There are several types of breast cancer. That is non-invasive breast cancer, invasive breast cancer, and secondary breast cancer. Non-invasive breast cancer. Abnormal cells are contained within the ducts of the breast. It is also called ductal carcinoma in situ, that is DCIS. Invasive breast cancer is two types, that is early breast cancer and locally advanced breast cancer. Early breast cancer. This means the cancer has spread from the duct or lobules into surrounding breast tissue. It may also have spread to lymph nodes in the armpit. Most breast cancer are found when they are invasive. The most common types are invasive ductal carcinoma, that is IDC, and invasive lobular carcinoma, that is ILS. Locally advanced breast cancer. The cancer has spread to other areas near the breast, such as the chest, including the skin, muscles, and the bones of the chest. Secondary breast cancer. It is also known as metastatic breast cancer. Cancer cells have spread from the breast to other areas of the body, such as the bones, liver, or lungs. This is also called advanced breast cancer. Breast cancer is the most common cancer in Australian women, representing 28% of all cancers in women. About 14,000 women are diagnosed each year. 1 in 8 women will be diagnosed with breast cancer by the age of 85. Although it can occur at any age, breast cancer is more common in older women. More than 2 in 3 are diagnosed in women aged 40 to 69. About 1 in 4 are diagnosed in women aged 70 and over. Nearly 80% of women diagnosed had IDC, while about 11% had ILC. About 130 men are diagnosed in Australia each year. This represents less than 1% of all breast cancer. Some people have no symptoms, but if you do, you may notice a change in your breast, or your doctor may find an unusual breast change during a physical examination. It includes a lump, lumpiness, or thickening. Changes to the nipple, such as a change in shape, crusting, sore or an ulcer, redness, unusual discharge, or a nipple that turns in when it used to stick out. Changes to the skin of the breast, such as dimpling, unusual redness, or other color changes. An increase or decrease in the size of the breast. A change to the shape of the breast. Swelling or discomfort in the armpit. Persistent, unusual pain that is not related to your normal monthly menstrual cycle, remains after a period and occurs in one breast only. Breast changes don't necessarily mean you have cancer. However, if you have any symptoms, have them checked by your doctors without delay. Some women have no symptoms and the breast cancer is found on a screening mammogram. There are 4 stages of breast cancer. In the first stage, the tumor is less than 2 cm in diameter and has not spread to the lymph nodes in the armpit. In the second stage, the tumor is less than 2 cm in diameter and has spread to the lymph nodes in the armpit. In the third stage, the tumor is between 2 cm and 5 cm in diameter and has not spread to the lymph nodes in the armpit. And in the fourth stage, the tumor is 2 to 5 cm in diameter and has spread to the lymph nodes. Treatment for early breast cancer aims to remove the cancer and reduce the risk of the cancer spreading or coming back. Treatment may include surgery, radiotherapy, chemotherapy, hormone therapy, and targeted therapies. Usually more than one treatment is used. Your doctors will consider the following factors to recommend the best treatment for you. The choice of treatment will depend on your test result, where the cancer is in the breast, if the cancer has spread, whether the cancer has the estrogen, progesterone, or HR2 receptor protein, your age and general health, and your preference. Surgery for breast cancer will involve breast conserving surgery and mastectomy. Breast conserving surgery. Surgery to remove the breast cancer and some surrounding healthy tissue is called breast conserving surgery. It is also called lumpectomy or wide local excision. Breast conserving surgery is offered if the cancer is small compared to the size of your breast. The surgeon removes the smallest amount of breast tissue possible. This will leave a scar and will change the size and potentially the shape of the breast as well as the position of the nipple. Mastectomy. Surgery to remove the whole breast is called a mastectomy. You may be offered a mastectomy if there is more than one cancer in different areas of the breast. The cancer is large compared to the size of the breast. You have had radiotherapy before to treat another cancer. Clear margins cannot be obtained after 1 or 2 breast conserving procedures. Some people may feel more comfortable having a mastectomy, particularly if they are unable to have radiotherapy. During a mastectomy, the nipple is also usually removed. The chest muscles are not removed. Some or all of the lymph nodes in the armpit closest to your affected breast may also be taken out. There are also many different types of therapy, such as radiotherapy. Radiotherapy uses high-energy X-rays to kill cancer cells or stop them growing. This treatment is recommended after breast conserving surgery to help destroy any undetected cancer cells that may be left behind in the breast and reduce the risk of the cancer coming back. Sometimes, after mastectomy, depending on the risk of the cancer coming back in the chest area. If lymph nodes from under the arm were removed and the risk of the cancer coming back in the area is thought to be high. There are many side effects of radiotherapy such as tiredness, red and dry skin, inflammation or blistering, itches and swelling. Chemotherapy. Chemotherapy uses drugs to kill or slow the growth of cancer cells. Chemotherapy is usually given before radiotherapy and may be used if the cancer needs to be shrunk or controlled before surgery. The risk of the cancer returning is high. To try to prevent the breast cancer coming back or spreading to other parts of the body. The cancer isn't sensitive to hormone therapy. Cancer returns after surgery or radiotherapy to gain control of the cancer and to relieve symptoms. It also has several side effects such as tiredness, mouth ulcer or weight changes or hair loss. Herceptin. It is a common type of targeted therapy for breast cancer. It works by attaching itself to HER2 positive breast cancer cell receptor. This can destroy cells and reduce their ability to divide and grow. Herceptin also encourages the body's own immune cells to help destroy the cancer cells. Hormone therapy. Hormone therapy, also called endocrine therapy, is for people who have hormone receptor on their breast cancer cells. The aim of hormone therapy is to slow or stop the growth of hormone receptor positive cancer cells. Cancer can cause physical and emotional strain. It's important to try to look after your well-being as much as possible. Eating healthy food can help you cope with treatment and side effects. A dietitian can suggest ways to manage special dietary needs or eating problems. Physical activity may help to reduce tiredness, improve circulation, and boost mood. The amount and type of exercise you do depends on what you are used to, how you feel, and your doctor's advice. These are used with conventional medical treatments and may increase your sense of control, decrease stress and anxiety, and improve your mood. Examples include massage, relaxation, and acupuncture. So, take care of yourself, and if you like more tips on health issues, then subscribe to my channel to check out my upcoming videos. That's all for now. Thank you.